They were told not to, but they did it anyway. Thousands of nurses across the state walking off the wards to demand better pay.
It's just not on. We are the worst paid nurses in the country now. Like, Victoria got what they asked for, so why not us? Come on, Mins, what are you doing, mate? It's not fair.
Not once have they offered you more than 3%, not once. It breaks my heart to hear of nurses who are working full-time jobs, struggling to pay their rent, struggling to put food on the table.
Thousands of nurses have walked off the job across New South Wales.
They rallied outside state parliament in one of the biggest walk-offs in 50 years.
Their rallying calls heard from inside the chamber.
The Premier can't hear over the voices of the nurses outside.
We acknowledge that there are very angry nurses out there that we are trying to get an agreement with.
Men of Macquarie Street, it's time to start listening. We want action.
This is our third strike and it's getting beyond ridiculous. Nobody's listening to us. Police are getting looked after, teachers are getting looked after, we're being forgotten about.
It's not fair to hold ratios over our heads and refuse to give us a pay rise. No other industry is expected to pay for their own resources out of the pockets of their workers.
We have had the walkout of the psychiatrists, we have put pressure on EDs. It's a mess and our patients are suffering.
The morale is just low. Like, people are openly saying, I'm looking for another job.
There have been no formal negotiations since October.
I want you to go into your MP's office and I want you to ask them, are you supporting a 15% pay rise?
The year-long dispute heads to court arbitration in September.
The NICU is so overcrowded, babies are being treated in storerooms, cots triple parked into the one-bed space.
How long can we keep hoping nothing goes wrong while working under conditions that make error inevitable?
We need to pay our aged care workers more.
Last year's 15% increase cost taxpayers about $11 billion over 4 years. Today's decision will take that total closer to $20 billion. Aged care providers say it will help them recruit urgently needed staff. Aged care work has been historically undervalued, principally because it's a female-dominated industry, and that this increase means their work will finally be appropriately valued.
And this investment in aged care workers is paying dividends for the older Australians, the older people in their care. Under the Albanese government, there is now a registered nurse on site in aged care 98.7% of the time on average. Older people are receiving an additional 2.16 million minutes of care every single day.
Don't let the aged care sector go down the gurgler again. Don't risk Dutton.
Nurses at a privately run hospital in Sydney are holding work stoppages today, demanding a 15% one-year increase and mandated patient ratios.
We don't have the ratios and it's unsafe and really, really awful for us to work under those conditions.
Healthscope won't acknowledge that with the cost of living, people are having to choose between having a fridge full of food for their families or petrol in the car to drive to work and do a shift.
Gathering outside Newcastle Private Hospital to send a message. The 26-hour strike, the latest in a series of rolling stoppages at Healthscope hospitals.
I'm not only risking my registration by being understaffed, also risking my patients' lives as well.
When you fight, you get more. If you don't fight, you don't win.
One of Australia's biggest private health operators, Healthscope, has gone into receivership.
Healthscope drowning in $1.6 billion worth of debt.
The private operator of scandal-plagued Northern Beaches Hospital wants out, offering to hand it back to the public system for a price.
But Healthscope insists it's not motivated by money or its repeated patient failures.
The government may take the hospital over, but admits it will come at a high cost.
Private health workers have walked off the job as industrial action continues over pay and staffing conditions. Nurses and midwives from Wollongong, Southern Highlands and Nowra private hospitals stop work for 4 hours.
We don't come out here lightly and strike. This is the first time in history that private hospital nurses have gone on strike. That's how desperate we are.
Staff walked off the job for 2 hours, calling for a decent pay and conditions offer, as well as a commitment to better patient ratios.
We're not going away, we're not giving up. It's about time Ramsay got serious and put a decent offer on the table.
need to start looking after us, or we're all going to end up in Queensland.
The right care to the right patient at the right time. And that's what we want, as well as a decent pay rise.
This is not how you treat a workforce that you care about.
I'm just sick of it. I want to be paid what we deserve, and I want the conditions that go with it.
And it's up to Ramsay to change their position and sort this out.
Nurses and midwives have struck a deal with the state's largest private hospital operator after 2 years of negotiations. The union voting to accept Ramsay Health Care's proposal of a 16% pay rise over 3 years, of which 9.5% will be paid in the next 12 months. The agreement also includes back pay from July 2023.
Cutting injured workers off is the most disgraceful way to fix the workers' comp system that was set up to look after injured workers.
The government is trying to make it more difficult for people to claim psychological injury, which I suppose will make their statistics look better, but actually isn't going to fix the problem at all. It's just going to end up with more people being injured and without any help.
This system is supposed to be here to protect us and to look after injured workers, not to attack them.